Do you want to have Alzheimer's because you listened to your gynecologist who was just afraid of giving the hormones but had no arguments?
Female HRT, because I very often have young ladies, 35, 40 years old, young ladies in my office that ask about those hormones as well. They say, well, my gynecologist says I'm starting already a bit of menopause and so on. And I always tell them, well, you're starting HRT, right? Because that will be much better for your skin. You will get older very soon if you don't do that. And they say, well, no, my gynecologist, he doesn't like it. He says I'm going to get cancer of it, and so on. So how to go about HRT for 35, 40-year-old women that aren't experiencing any symptoms, but they're getting older. So how to go about that?
It's relatively easy. As we have women taking female hormones already age 20, 25, 30. One of the big problems with the birth control pill is that they're all low dosed in estrogens. So they're already premature aging because of that. So we sometimes give a birth control pill plus female hormones so that they have the right balance, because what we want to be is that the patient is fine, the health is better. For me, it's very easy. I have no problems to convince, because it's not easy to go to our places. So many people who want to be, and so they already are somewhat convinced. But basically, I say, and I have the studies, and I show the studies in my workshop, from age 30 on, there's a significant decrease in female hormones, estradiol and progesterone. And that's the age you should start treating, because otherwise you get those little wrinkles above the upper lip, you get a pale face, your eyes are dry, you cannot put your contact lenses as easy, and your hair gets flat. Do you want that? And then you say, all those signs is not so important. What is important is that you might get easier atherosclerosis. You get bone loss. And women who have not taken female hormones in their lifetime and are older, they have, I think it's 4 to 8 times more risk of Alzheimer's. Do you want to have Alzheimer's because you listened to your gynecologist who was just afraid of giving the hormones but had no arguments? I looked at all the studies where female hormones were given to breast cancer women who had breast cancer. They took their tumor away, they gave them female hormones, and they have a decrease in recurrence, 30 to 70% decrease. If there are estrogen and receptor positive tumors that respond to female hormones, 70% decrease in recurrence if you get the female hormones after. So it's not a contradiction, it's an indication. Mm-hmm. And there's a mortality decrease by 20 to 80%. There's only one study on 14 that showed the opposite, but it used a toxic progesterone, hydroxyprogesterone acetate. You need to have the bioidentical ones, the same structure as in the body, and then it's much safer, and there should be a balance. I will say to women who have had breast cancer or who want to avoid breast cancer, don't get breast pain. If women have during 5 years breast pain, doubles their risk of breast cancer. If they have during 10 years breast pain regularly, 4 times more breast cancer. So why would you get breast pain? It hurts and you get more breast cancer. You just lower the dose of estrogen and take more progesterone, and it's okay.
Mm. So you're also first checking the blood and then starting right away progesterone, estradiol, and testosterone probably.
What we do really is we examine our patients. So we have a questionnaire with all the questions of their complaints. And then when we do it, we go to the physical exam. We look at all the physical signs. Often patients say, I've never been looked over so in depth. And then we look at the lab tests that often arrive at another consultation. Because in Belgium, if a physician wants to make blood tests, he has to first examine his patient, then prescribe the blood test, and then in a second consultation later, give the treatments. So we give this, and then we balance the treatment, and the patient has to come back. And this feedback is very important. If they don't come back, often it's imbalanced. So you need really to do it roughly. And that works well in general, and you can do a personalized treatment with everything.
Yeah, very good. Very interesting, Thierry. Thank you so much for all the info you provided. There's quite a lot. We talked about a lot of things. If people would want to work with you or one of your colleagues in your clinic, how to reach you?
Well, we have a website called, you just put my name, Thierry Hertoghe, on the website, and you'll find the official website of Thierry Hertoghe. And you can even take a consultation. It's more difficult to come to me. I see some patients go very far, it's higher fee too, and things like that. So you need to telephone to the secretary if you want these very specific consultations that go much in depth. But we have 4 doctors who are really knowledgeable, and which we have an interaction. So you can also ask an advice of my part. It's like €100 for an advice. It takes me a certain time to make it up, so you have more optimal treatment then, or more assurance of having it. But you of course have to fill in your demands and in the questionnaire. And so we have a website, official. So it's the official website of Dr. Hertoghe. We are in Uccle, and people who live in Brussels is the Fort Jacot, and there's generally possibilities of parking, and if you want to do a walk nearby, it's full of woods, so it's very pleasant. But it's not far from the center, maybe 15 minutes from the center if you go with the train or something. And of course, you can take then a bus, but with taxi, it's like 15-20 minutes if there's no traffic. Mm-hmm. Very easy.
Awesome. I'll put the links to your clinic, our website, in the description of this video. So thanks again, Thierry, for doing this. And I'll be sending my patients that want to do HRT your way. So thank you very much. And talk to you next time. Check out my TRT workout split or the ebook The Ultimate Guide to TRT Cream. Links to the merchandise shop in the description.